You take an acidity tablet after meals. You take it before sleep. You take it every day, for months, for years, because it gives relief, because it feels harmless, because many people around you take it too. But here is a question most people never ask. Can daily acidity medicines slowly harm your kidneys? Most patients are shocked when they hear this, because acidity medicines are seen as safe, easily available, often taken without prescription. Today, this video is extremely important for you because this risk is often ignored, often underestimated, and rarely explained clearly. By the end of this video, you will understand how acidity medicines work, which acidity medicines may affect kidneys, who is actually at risk, and how kidneys can be protected without panic. Acidity is a very common problem. People feel burning in chest, sour taste in mouth, gas and bloating, pain after meals because stomach acid irritates the food pipe. Acidity medicines reduce stomach acid. They give quick relief. This is why millions of people take them daily. Some take them for weeks, some for months, some for many years, often without follow-up, often without tests. The problem is not short-term use. The concern is long-term daily use, without medical review, without knowing hidden risks. There are different types of acidity medicines. The most commonly used strong acid-reducing medicines are proton pump inhibitors. These medicines switch off acid-producing cells. They are very effective, but strong medicines always have strong effects, including effects outside the stomach, including effects on kidneys. Let us understand how daily acidity medicines can affect kidneys. One important mechanism is inflammation. Some acidity medicines can cause kidney inflammation. This condition is called interstitial nephritis, which means swelling inside kidney tissue. This swelling reduces kidney filtering ability. The dangerous part is this damage can happen silently, without pain, without change in urine color, without obvious warning. Many patients are diagnosed late, only when creatinine rises on blood tests. Another mechanism is mineral imbalance. Long-term acid suppression affects absorption of magnesium. Low magnesium stresses kidneys. It also affects heart and muscles. Kidneys struggle to balance salts. Over time, this imbalance adds burden. Another issue is dehydration risk. Reduced stomach acid can change digestion. Some people develop diarrhea, and dehydration can cause kidney damage. Now let us talk about who is more vulnerable. Not everyone taking acidity medicines gets kidney damage. Risk increases in certain situations. People above 50 years of age, people with diabetes, people with high blood pressure, people already having mild kidney weakness, people taking painkillers frequently, people taking multiple medicines daily, people who self-medicate for years. Risk is also higher when acidity medicines are taken twice daily or combined with other drugs without doctor guidance. Now let us talk about what happens if this problem is ignored. Kidney injury, due to acidity medicines, is usually slow. Creatinine rises gradually. Patients feel normal initially. They continue medicines thinking acidity is controlled, but kidney damage progresses silently. If inflammation continues, permanent scarring can occur. Once scarring forms, recovery becomes difficult. This is why early detection matters. For junior doctors, this point is crucial. Always ask about long-term acidity medicine use, especially when kidney injury has no clear cause. Stopping the offending drug early can reverse damage in many cases. Now let us focus on prevention and kidney safety. The first step is awareness. Acidity medicines are useful, but they are not meant for lifelong daily use without review. Use the lowest effective dose. Use for shortest required duration. If symptoms persist, investigate the cause. Do not keep increasing dose blindly. Lifestyle correction is extremely important. Eat smaller meals, avoid late-night heavy dinners, reduce spicy and fried food, avoid lying down immediately after meals, maintain healthy body weight. These steps reduce acidity naturally, reducing medicine dependence. Hydration protects kidneys strongly. Drink adequate water throughout the day, especially if you are on long-term medicines. Unless fluid restriction is advised by your doctor, proper hydration improves kidney blood flow. Medication review is essential. Some patients can shift to milder options. Some can use medicines only when needed. Some need step-down therapy. Never stop medicines suddenly without advice. Always discuss alternatives with your doctor. Now let us address common myths clearly. Myth 1. Acidity. Medicines are completely safe for lifelong use. This is false. Long-term use requires monitoring. Myth 2. Only painkillers damage kidneys. This is false. Many medicines can affect kidneys, including acidity medicines. Myth 3. Kidney damage happens only after many years. This is false. In some patients, inflammation develops within months. Now let us talk briefly about scientific evidence. Large population studies have shown this association. Research published in journals like JAMA and Kidney International has reported increased risk of chronic kidney disease. In long-term users of proton pump inhibitors, studies from the last decade, including observational studies from 2016 onwards, have shown higher incidence of kidney injury compared to non-users. These studies do not create fear, they create awareness. They remind doctors and patients to use medicines wisely, not blindly. Let us summarize calmly and clearly. Acidity medicines are effective. They relieve symptoms. They improve quality of life, but long-term daily use needs caution. Kidneys are silent workers. They filter everything we take, including medicines. Awareness prevents damage. Simple tests detect problems early. Doctor guidance protects kidneys. If this video helped you understand this risk, please like this video. It supports medical education. Subscribe to Kidney Focus for weekly kidney, bladder, and prostate guidance. Comment your questions below. Tell us what worries you. Share this video with someone who takes acidity medicines daily. Correct knowledge reduces fear and protects kidneys. Thank you for watching.